I'm only a presenter of this lecture, speaker. We have only 3 months experience with the therapeutic method nuclear magnetic resonance. I was asked by the German company MBST to present the possibility and some results of this completely new therapeutic method. Nuclear magnetic resonance therapy derived from nuclear magnetic resonance imaging technique has been developed recently. The active principle is based on the same principles as nuclear magnetic resonance diagnostic systems. The magnetic resonance therapy appliance generate a static magnetic field and a three-dimensional radio frequency field leading to the build-up a nuclear resonance field at the site of the treated tissue. The frequency and intensity of the electromagnetic field in the nuclear magnetic appliance is adjusted appropriately to induce resonant vibration of molecular structures within cartilage or bone tissue, thereby stimulating cell proliferation. A special permanent magnetic field causes the protons of hydrogen atoms align their resonant axis along the field lines. A radio frequency field on the nuclear resonant frequency transfers energy to the protons, which transfers the extra energy highly effectively into the surrounding tissue. This added energy is therapeutic as it supports the cell regeneration and cell division rate. I will present shortly two results of or methods of two clinical studies. The first study is by Professor Kulich and Professor Schwann. It was presented as a poster and later published in International Journal of Back and Musculoskeletal Rehabilitation in 2006. It was placebo-controlled, double-blind, randomized, monocentric, multiple data study. Duration was 3 months. The rehabilitation, it was multidisciplinary rehabilitation concept that was standardized inpatient physiotherapy program, including gymnastics in and out of the water, mechanotherapy, massages, parafungo applications, and medicinal baths, excluding electrotherapeutic applications on the spine as well as hydroelectric baths. 5 treatments of 1 hour each on 5 consecutive days. As I mentioned, it was a double-blind randomized by coded chip cards, activation of construction of the complex therapy fields or no activation. It was used for placebo group. Examinations was done before treatment, 1 week as well as 3 months after the 5 treatments. Evaluation was carried out by visual analogic scale. Peak level of pain, mean level of pain when moving, level of pain at rest, level of disability by Roland Morris questionnaire. In the picture on the left, you see after 3 months result. However, the Roland and Morris score of patients belonging to group without MBST therapy had increased again and was not significantly less than the starting value. On the other hand, those patients who were treated with a hours showed, according to Roland and Morris score, that was still at the end of 3 months significantly better than the starting value. It is very interesting to note that the patients of MBST group still reported a statistically significant reduction of pain as late as 3 months after termination of the therapy. The pain reduction at the time in patients belonging to the placebo group, however, was only 13.8% and therefore no longer to be regarded as statistically significant improvement. In general, the patients belonging to the active magnetic resonance therapy group reported that the treatment was agreeable, did not cause any pain, and did not experience any negative side effects. The next assessment was by the Oswestry score. It showed a similar result with significant improvements in both groups after 1 week therapy, further improving after 3 months. The positive changes in the section personal care are of great importance, showing the more than 70% of the magnetic resonance therapy group reported improvement. You see it here. Results: the Roland Morris total score for low back pain for all patients during the 3-week inpatient rehabilitation period after 3 months. Placebo patient had decreased again. Patients treated with magnetic resonance therapy showed a Roland Morris score that was significantly better than initial value. The Oswestry score after 3 months showed in 70% none of them any deterioration. Both results revealed good effectivity of the standardized rehabilitation program. The second study is also by Professor Kulich. It was presented as a poster and called 1-year survey with multi-center data of more than 4,500 patients. Magnetic resonance therapy has been shown to stimulate repair processes of cartilage and to reduce pain signaling. It represents an alternative therapy for patients from osteoarthritis. To prove the clinical success of this new therapeutic method, validated measuring parameters are important that are convincing for pain and function in a 1-year follow-up. During the course of its application over the 10 years, 4,500 protocols of a 1-year follow-up have been collected to record the outcome of magnetic resonance therapy. This report reflects the outcome of this therapy on patients with the following degenerative rheumatic diseases and of treated patient. There were 4 groups: patients with osteoarthritis of the knee joints, with osteoarthritis of hip joints, and osteoarthritis of ankle joints, and the 4th, patients with chronic low back pain. Data were collected at baseline and again after 6 to 8 weeks and 6 and 12 months after nuclear magnetic therapy. Results: pain reduction significantly 6 weeks after treatment. All 4 examined indications improved and stayed measurably reduced up to 6 and 12 months. The improvements in all 3 forms of pain, it means pain of load, pain of motion, pain at rest, following magnetic resonance therapy, well around 21 to 50% on average. There was treated a cohort of 655 patients with chronic low back pain. The magnetic resonance therapy also had a clear influence on low back pain, which was remarkably reduced during daytime peaks, as well as pain load on and rest during the 1-year monitoring period. The intensity of pain on load was reduced remarkably 1 year after this type of therapy. It decreased from on average of 5.01 to 2.86. Parallel to its intensity, the median of the peak decreased, and also the intensity of pain at rest was reduced clearly and significantly. With conclusion, nuclear magnetic resonance therapy is a novel, highly technical therapy procedure for which the effective mechanism has been derived directly from nuclear resonance tomography and is used in more than 300 centers Europe-wide. The nuclear resonance field has a predefined cell frequency, which is an amplitude modulated with a spine frequency. The purpose is to bring the highest possible actively directed energy transfer using the smallest possible field strength. Magnetic resonance therapy to be an additional therapeutic method that is easy to apply and that requires only short therapeutic procedure of 5 hours in 5 days. This therapy can positively enhance therapeutic success in the rehabilitation of patients suffering from low back pain without side effects. Thank you for your kind attention.
Yeah, thank you for this paper. There is a question.
I'm doctor from Kazakhstan. Thank you for the interesting document, and you are very brilliant inverter. It's I have questions. First, you know, have you used MRI for control morphologies changes or no? And how many Tesla using this technique, such diagnostic MRI or no? Thank you.
I can understand the question. This method is used only for therapy, but it arises from diagnostic magnetic resonance therapy. There was observed that some patients after this diagnostic examination feel some bettering of their symptoms. I can confirm it because 3 years ago I had very severe low back pains. I cannot sleep. I think about surgical consultation, and I was examined by nuclear magnetic resonance therapy, and after this 1 hour diagnostic examination, during a few days I feel a relief of my very severe low back pains, and I again started to row, and I started normal life as before, and it lasted till now more than 3 years.
Переведите для экономии времени, что я имела в виду, что боль пациента – это очень субъективное понятие, и это понятие хотелось перевести в какие-то или морфологические, или физические характеристики. Я имела в виду, что если мы используем
this technology for treatment, this method, why was it never used for control or verification or visualization of results or any morphological changes observed? What does it mean, less pain? Is the nerve root less compressed, or the disc is less compressed? And also, what the magnetic field should be, the value, how many Teslas?
Yeah, this is already assessment by questionnaires, but these questionnaires are significantly positive this nuclear magnetic therapy is also in last year used for treatment of patients with osteoporosis, and there are 3 or 4 small studies that proved that bone density measured by densitometry DEXA was improved. This is also the aim of our clinic, to prove this method in patients with osteoporosis. When we prove it, it will be evidence-based medicine that confirms the effect of this magnetic nuclear therapy. That is why I present this study here, because we would like to prove it at first in a short study of maybe 10 patients, and then if it will be, if we will have positive results for effect of this magnetic resonance therapy, we would like to ask for European grant and provide multicentric study of this treatment in patients suffering from osteoporosis. It is why I presented it, because we also had opportunity to in future use this method, and we can do this grant research project realized together.
Okay, there's another question from the